Hello, I am Dr. Mark Stickney, and welcome to Ask the Vet Live, presented by Good Charlie Energy. Happy fall, happy October, happy Halloween. You can tell here in San Antonio, where I am located at, that it is fall because even though it's still hot during the day, when you walk outside, you do not, in the first thing in the morning, you do not immediately break into a sweat. So that has been really nice here lately. Well, as always, over the next 30 minutes, we're going to talk about happenings here at Spay Neuter Network and events that are going on, things that we should know about, and of course, we will take your questions that you bring in live to talk about here while we're on screen. And then I also have some questions that have been emailed to me ahead of time. As the weather starts to change here, if you are looking for a new energy provider and you are in an area where Good Charlie Energy can provide that for you, go ahead and take a look at them, see what kind of plans they have, and remember that every time you pay your bill to Good Charlie Energy, they will donate and they will make a donation to organizations that help pets, such as Spay Neuter Network. So that is a great way to give back while you're getting something as well. So let's see what we have going on. The month of October is, well, first, this week in October is National Vet Tech Week. And I would like to give a big heartfelt shout out to all of our technicians here at Spay Neuter Network, my ones here in San Antonio in particular that help me get everything done that we do, and all of the veterinary technicians in all of the veterinary practices everywhere. Without our technicians to help us with the things that we do, I have always said that I may as well not even show up to work if I don't have my technicians there to help me. They do so much to streamline the things that I need to do as a doctor, so that we can make the most of our time and be able to help as many pets as possible. So thank you very much to all of the veterinary technicians for everything that you do every single day. October is also National Pet Wellness Month, and that is an important thing to think about our pets and the wellness, taking good care of them, because our pets really do so much for us as well. There are multiple studies that have shown how petting an animal will lower your blood pressure, how it will release feel-good hormones in your body, help you relax, help you stay calm. So pets are really good for our health. And if you've got a pet that you take outside for a walk, you go play ball, go throw the frisbee, go to the dog park, not only are they getting exercise, but you're getting exercise too, and that's a good thing for us. So it's good for us, and we want to make sure that we take care of our pets. And a couple of the most basic things that we can do for wellness for our pets is to make sure that they are vaccinated against diseases that they could catch, and that they are on heartworm prevention and some kind of flea and tick control, so that we can get all of those parasites under control and give them the easy things to do that will help them to enjoy their lives. And along those lines, for pet wellness, we can help a lot this month with here at Spay Neuter Network, because we have lots of vaccine events here coming up in October. You will be able to get all of the details about what I'm going to talk about here on our Facebook event page or at spayneuternet.org. So keep that in mind. You don't have to be furiously jotting anything down right now, but we have some upcoming free vaccine clinics. All of them will have free parvo distemper vaccines for dogs and free FVRCP combo vaccines for cats. We will have other vaccines available at a low cost. And the first one of these is tonight, October 15 at 6 p.m. at Balk Springs Animal Services. And then this Saturday, coming up in just a couple of days at 9 a.m., we will be at Warren Sports Complex in Frisco, Texas. Next week, October 22, we will be in Dallas at Green Pet on Balboa Drive. And coming up in November here in San Antonio, we will be having another another vaccine clinic here, location to be announced. So that's really exciting. So stay tuned for that. You can follow us on our Facebook page and get all of those updates and know when those are going to happen. So again, those are our free vaccine clinics, free distemper parvo vaccines for dogs, free FVRCP vaccines for cats, other vaccines at a low price so that all of our pets can get vaccinated, and then we can do everything that we can do to help maintain our pets' health and wellness. Now, October is also Black Cat Awareness Month, and this always makes me a little bit sad to have to say that, because that means that we need to be aware of black cats and not letting them get into trouble this month, especially as Halloween gets closer. Black cats, people will associate those with Halloween, and sometimes people will do just mean things to cats. So we want to be aware of our black cat friends, and definitely want to keep them indoors and safe, especially on Halloween night, so that no one does anything mean to them. That's just terrible. Speaking of Halloween, that is whether you have trick-or-treaters come to your door or not, that is a big night with lots of activities. There's lots of extra traffic on the road in neighborhoods, lots of extra foot traffic, and this is a good time to keep all of our pets indoors so that they are not getting themselves upset, barking. We don't want them to get scared by people making a lot of noise. We don't want them to potentially run out the door into the street and get hit by a car. So Halloween, you want to make sure that all of your pets are safely indoors and not where they can slip out the front door. Cats and some of these little dogs are very sneaky about trying to slip out every time the door is open, and you may be opening your door quite a bit on Halloween night. So make sure they're somewhere in the house where they can't escape, and they'll be nice and comfortable and safe. Okay, let's see. While we're waiting for some questions to come in, let's take a look at some questions that have been sent in to us prior to coming on the air today. So our first one is from Kayla, who writes that my cat broke her nail playing outside. She spends a lot of time outside, and today I found her with one of her nails broken. It was not bleeding, but the broken nail was still attached. I cleaned it with some antiseptic, and she doesn't seem to be in pain, and she's also not licking or biting at it. In fact, she's sleeping right now. I want to know if I can treat this at home, or do I have to take her to the vet? I also want to prevent infection. Well, that is a great question, and that is a very common injury for cats and for dogs, a broken nail. So there's two types of broken nails, and you can kind of think of this as like your own fingernails. You can chip a nail or break a nail, and it might be uncomfortable, but it's nothing major, right? You're going to be able to file that down, and it's not going to be a problem. And with dogs and cats, they also have a nail layer that is covering over the quick of their nail. So if the nail is not bleeding, if the area is not bleeding and you don't see any exposed pink tissue, then that means that it is just the nail itself that has been broken, and we don't have the nail bed exposed. So a broken nail can just be trimmed back to so that we get rid of that broken part, and we should be good to go. Now, if the nail is bleeding, or we see any kind of pink tissue associated with that, that is going to be a break that has gone all the way down to the nail bed, all the way down to the quick. And that is going to be painful, and that can potentially get infected. If that is the case, you would want to take your pet into the veterinarian, and they can trim away any of the nail material that is still there and start that pet on some antibiotics and some pain medications while that heals up. An excellent question. All right. Grace writes, "Hi, I took my 16-month-old kitty to the vet the other day for his 1 year rabies booster, and I asked about the FVRCP booster because I read cats should have it every 1 to 3 years. I was told that he had the kitten shots and does not need a 1 year booster because he's strictly an indoor cat. However, I read that even indoor cats should have the booster just in case. I'm not sure if this is something I need to worry about. I'd rather be safe than sorry. Is he okay without the booster, or should I take him somewhere else? So that is an excellent question. We talk a lot about vaccines, and we don't necessarily want to over vaccinate our pets. We want them to get what they need, but we don't want them to get more vaccines than they need. So the current recommendations would be that we would get our kitten series, and then also get that 1 year booster. And then after that, based on the lifestyle of the cat, we can discuss how often we need to get boosters after that. Of course, rabies, depending on where you live, is going to be an every year or potentially an every 3 year vaccine, but it's usually every year. So that's something that we would want to always get done. But the recommendations would be to get that 1 year booster just in case they get out. That way they've got a good immunity. There's also some recommendations now that they actually get a 6-month booster as well. So I would definitely recommend that we get that 1 year booster, and then after that we can go from there, deciding how often vaccines would be appropriate for your cat. All right. Ethan writes in and says, my 15-month-old pup was spayed about 5 months ago, and I think a stitch might have been missed during her checkup. Everything healed fine until today. She suddenly got a big blister right on her old scar that burst open and started oozing. I cleaned it with alcohol and put some Neosporin on it. Any idea what could have caused this? Okay, so that's a great question, and without a super clear answer, because we did get spayed, but it happened 5 months ago. So that's been a long time for the incision to heal, and that's been a long time for any suture material that was there to break down. So potentially, if some non-absorbable suture was used and some of that stayed behind, that could potentially have caused this to happen. It could have gotten a reaction and a little minor infection. But it's also possible, probably more likely, that we happen to get bit or stung by something, or right in that area, and it's just coincidental that it's along with right along where the old incision was. So I would say to monitor that, and if it does not improve in a day or two, have him checked out at your veterinarian, and let's see if there's something a little deeper down in there that's going on. We will sometimes see with dogs and with cats, they will get suture reactions, but those typically happen within a week or two of surgery, not 5 months later. So that's going to be something to keep an eye on. Okay, Morgan writes in and says, hello, my cat has pretty bad tartar buildup on his back teeth, and it's very common in cats. It's hard and calcified, not just plaque, and his gums look a little inflamed. I'm saving for a vet cleaning since it's pricey, but in the meantime, is there anything safe I can do at home to help reduce it or make him more comfortable? That is an excellent question as well. The dental disease, dental plaque, dental tartar, based on what study you're looking at, is usually the number 2 or the number 1 underdiagnosed issue with our pets. And you think about how we brush our teeth all the time, or at least we should, right? And we still have to go in and get dental cleanings. Let's see, I lost my train of thought. So we still have to go in and get dental cleanings as well to get rid of all that tartar. And the same kind of thing happens with our cats, with our pets, and they need to get dental care as well. And it's great that you've got that dental prophy in mind. So the question now is, what do we do in the meantime, right? So the best thing you can do to help reduce plaque and tartar is to brush your pet's teeth. And some dogs and some cats are much better about this than others. But what you can do is get a cat toothbrush, which is actually looks more like a little rubber thing you would put on your finger. It has little bristles on it, and you can get some cat toothpaste that is usually delicious liver or chicken flavored, and you use that little brush and that toothpaste, and you just kind of see if they will allow you to rub along inside their mouth, along with their gum, along on their gum line, and along with their teeth, and see if you can get that tartar broken down. You probably are not going, if the tartar is already there, it's not going to make that tartar go away, but it is going to prevent more of a buildup, and it will help to get up underneath those gums and help with that gingivitis a little bit. If your cat won't tolerate that, the other thing that you can do is go to the pet store, Petco, your local pet store, and you want to look for some dental treats, and you want to find treats that have a VOHC label on them, which means Veterinary Oral Health Council. And that means that those treats have been looked at by veterinarians that are specialized in dentistry, and they treats will actually help to reduce the amount of tartar and plaque. And you can give them those treats, and that will help in the meantime as well. Great question. Okay, let's see here. All right, Taylor writes in with a heartworm treatment question. Taylor says, my dog just tested positive for heartworms, and I'm really worried. She's a 1.5-year-old, 68-pound Belgian Malinois. All right, so a young dog and a big dog. She has been getting tired faster when we play fetch, so I took her to the vet. He's been practicing, and he's recommended the slow kill method for the dog, saying it's easier on her body and more affordable. Since she's young and otherwise healthy, he said there's no rush for the fast kill. He prescribed antibiotics, doxycycline, and told me to use HeartGuard Plus or Simparica Trio. I feel awful knowing that it could take 1 to 2 years for the worms to die, and I'm tempted to ask about switching to the fast kill instead. Cost is not a concern. I just want what's best and safest for her in the long time. Do you have advice on which method is best for a younger, healthy dog? So, absolutely, hands down, the fast kill method is going to be the best method for getting these heartworms, getting rid of these heartworms as soon as possible. So just in a little brief summary for anyone that does not know, when we have heartworms, they are worms that live in the heart and in the pulmonary artery near the heart, and they create an obstruction in the heart because they're taking up space that blood should be pumping through. Instead, there's a big clump of worms right there. And what happens is that puts extra workload on the heart. It causes inflammation of the surrounding tissues in the lungs and in the heart, and it can cause some respiratory distress and make their heart work harder overall. The slow kill method is a method where you put them on heartworm preventative, and very slowly over a period of years, the worms will die and they will not get new infections. So you just wait for these worms to die. The problem is that over those next couple of years, you've got worms in there taking up space, making the heart work harder, inflaming the lungs, and causing damage that can potentially be permanent. So if cost is not an issue, the fast kill method is definitely the way to go. And that way, over the course of 2 months, all of the worms will be dead and they will be out of the dog, and we can go back onto life as normal. So that would be my recommendation, would be to go with that fast kill and get those heartworms dead and out of your pet's body as quickly as possible. And that way we will not have any sort of long-term effects on our heart. Now, one thing that you want to keep in mind with the fast kill method is that during those 2 months, while we're doing that method, strict exercise restriction is a necessity. So it's going to be important to have a crate that your dog can rest in, and we're just going to go outside and do our business, and we're going to go back into the crate, because all of those worms are going to be dying and breaking up in your dog's heart and in your dog's lungs, and we don't want them to create any sort of a blockage or an obstruction, or cause any sort of increased inflammation in our lungs that could potentially be life-threatening. So that's one thing that you need to be prepared for as you do that fast kill method. Okay, excellent. All right, Emily says that she has just adopted a 2-year-old rescue dog from a local shelter, but they did not have any medical records for her. I have no idea what vaccine she's had or when her last ones might have been. What should I do if I don't have any vaccine history? Can you safely restart her vaccines, or is there a way to test or check before giving more shots? So, if you do not know any vaccine history, you definitely want to have this dog vaccinated for rabies, because that is required by law. And you will also, I would recommend also going ahead and getting some vaccines on board, and that way we know that she is vaccinated. She's a 2-year-old dog, so she's already an adult dog. So she is likely to need only one vaccine, maybe one booster, but that would be the most direct and least expensive way of getting her up to date and under control for her vaccines. There is a way that you can check for vaccine titer levels in their blood and see if they have antibodies against the different diseases that we vaccinate for. But it is more expensive, and there is not a whole lot of consensus on exactly what those levels mean. So it is perfectly safe to go ahead and get her revaccinated, and that would be what I would do if it were my dog. Great question. All right. Okay, here is a question that has come in. How old do kittens have to be spayed or neutered? An excellent question. And at Spay Neuter, the answer is very, very young. Here at Spay Neuter Network, our recommendation is that we will do them as early as 2 months of age and 2 pounds of weight. So we will do them when they're little kittens, and that way they never go into a heat cycle if they're females. They never want to start spraying and marking their territory if they're males. And when they are that young, they just bounce back from the procedure almost like nothing happened. They are just little healing machines, and they are ready to go. So it's a really easy procedure on them as well. So I recommend with cats, kittens, doing that as soon as possible. And here at Spay Neuter Network, we can do it at 2 months and 2 pounds of weight. So that is your answer. And that is a wonderful question. Thank you so much for that. Okay. Nathan writes in and says, I see so many different types of pet food now. Grain-free, raw, all-natural, limited ingredient, high protein. It's honestly overwhelming. Nathan, I agree with you. It is crazy, all the options that are there. I want to make sure I'm feeding my dog something that actually supports her health long-term, not just what sounds trendy. How can I tell if a pet food is really good quality? Are there certain ingredients or labels I should look for or avoid when choosing food? This is an excellent question, Nathan, and it can be a very confusing thing to figure out. A lot of times your veterinarian can guide you in that choice, but here is what I would tell you that the biggest things that you want to look for. So first off, any food you look for, you want to see that it meets the standards of the AAFCO, which stands for Association of American Feed Control Officials. And this is an organization, and it's private, nonprofit organization, and it goes in and it has established what dogs need as far as their nutrition at different ages and lifestyles. So that's the first thing you want to do, is look for something that has that AFCO approval on it. Second thing you're going to want to do is look at how old is your pet. If your dog is less than a year old, you'll want to feed a puppy food. If it is older than a year, you will want to feed an adult food. And then once we get to be 7 years or older, that is when we consider a dog to be senior, and that's when you will want to feed them a senior type of food. Exactly, you'll see things like lamb and rice and chicken and potato, all kinds of things like that. But that's all fine. That unless your pet ends up with a food allergy of some sort, that doesn't really make any difference. But the other biggest thing that you're going to want to look at is be aware of is how much you're feeding your pet, because it is very easy to overfeed, and pets that become obese will be dead or will die 2 or 3 years sooner than pets that are at a nice healthy body weight. So it's important to feed them a measuring cup amount of food based on their weight and their size, and to not let them overeat and put on weight. Just like with us, once the weight's on, it's hard to get it off. So that would be the other thing to keep in mind. Okay, let's see here. Okay, Rosa writes in and says that she has an indoor cat that sits by the door and meows nonstop every time she sees me getting ready to go outside. I don't want her roaming freely because of cars, other animals, or getting lost. She's about 3 years old and super curious, always staring out the window or trying to dart out when I open the door. Are there safe ways to give her some outdoor time or stimulation without letting her wander? I've heard about things like catios, harness training, or even supervised backyard time, but I'm not sure what's safest or easiest to start with. Okay, so great question. Cats are curious creatures, and we want them to be engaged in things and have stuff to keep themselves busy. So there are a few things that you can do. You are absolutely correct that cats that roam are more likely to become injured by cars or other animals or get themselves into trouble somehow. So I would not start with supervised backyard time right off the bat, because you never know what a cat's going to do. You never know if it's going to get startled and go jump over the fence or something like that. So what you can do is, there are the catios that you mentioned. They also make window boxes that are a little bit more, that may be a little bit easier to handle. And they will go into an open window, and they kind of project out of the window, and they're usually screened in little boxes. And that way your cat can go out there and get some fresh air, but he's contained in a little box, basically. So that's one thing that you can do. You could also look for some enrichment things inside your house as well. You could get a cat tree and put that near a window where they can jump up and get higher and look around. If you keep your cat indoors, you could put a little bird feeder near your window where the cat looks out of, and that cat could sit and watch the birds all day long, go into the bird feeder. That would be like cat TV. Most cats are very, very interested and enjoy watching that type of thing. Harness training is a good thing to do if your cat will tolerate it. Not all cats will take to the harness, but that is also an option for you. If you do start having your cat go outside, you want to make sure that you are up to date on your vaccines, because there are lots of other cats and lots of diseases out there our cats can catch. And we also want to make sure that they are microchipped in case they do get away, get lost. A microchip is the most effective way of having a lost pet be returned to you. Those are all very good questions. Thank you, everybody, for joining us today at Ask the Vet Live. And please remember that to check out our links on our Facebook page for things that we have going on, and check out our links for our collaborator, Good Charlie Energy. They offer not only electricity plans, but as a member of Good Charlie Energy, you also have access to 24/7 veterinary telehealth. They have a discount pharmacy there, so they are a great partner for us, and something worth checking out. Thank you for your time today. Enjoy the rest of the month, and we will see y'all in November. Thank you. Have a great day.